is a strain of influenza, flu, that infects mostly wild water birds but can infect domestic birds, poultry, and other animals. These strains belong to influenza A-type viruses. It's not usual, but bird flu can also infect people. The most common subtypes that may affect humans are A, H5N1, A, H7N9, and A, H9N2. The symptoms can range from mild, pink eye, to severe flu-like illness that results in respiratory failure or death. Who does bird flu affect? Affected people include those who have generally had contact with live or dead infected birds. These can include domestic poultry, chickens, turkeys, waterfowl, ducks, geese, and birds of prey, falcons, that have been in contact with infected waterfowl in the wild. Infected birds shed the virus in their saliva, feces, poop, and mucus. In very rare cases, these people infected by contact with infected birds may have infected members of their families and other close contacts. People who are most at risk of developing a serious illness after being infected by bird flu include 1. Pregnant people. 2. People with poorly functioning immune systems. 3. People who are 65 years old or older. What are the signs and symptoms of bird flu? The signs and symptoms of bird flu in people may vary. They may include typical flu symptoms like 1. Fever of 100 degrees Fahrenheit, 37 degrees Celsius, or higher. 2. Cough. 3. Body and muscle aches. 4. Sore throat. 5. Nausea and vomiting. 6. Diarrhea. 7. Stuffy or runny nose. 8. Pink eye, conjunctivitis. Bird flu may also cause severe respiratory symptoms and conditions, including 1. Shortness of breath, dyspnea. 2. Pneumonia. 3. Acute respiratory distress. 4. Respiratory failure. Infected individuals may also develop secondary bacterial infections. In severe cases of avian flu, an infected person might experience neurologic symptoms like seizures or mental changes. Bird flu might also cause multi-organ failure or septic shock. What causes bird flu? You can become infected if you breathe in the virus that is present in droplets or dust. You can also be infected by touching something infected and then touching your eyes, nose or mouth. Bird flu has been passed from people who were infected to people who had no contact with infected birds, but this has been rare. You can't get bird flu from eating properly processed poultry or eats, but you should avoid eating anything that has raw poultry or blood as an ingredient. Diagnosis and tests. What tests will be done to diagnose bird flu? Bird flu can't be diagnosed by symptoms alone. Your provider may take a swab from your nose or throat. These specimens need to have specialized testing done and you may be referred to a public health department. Best results happen when the testing happens early, as symptoms develop. Management and treatment. How is bird flu treated? Bird flu is treated with antiviral medications. Common treatments are 1. Oseltamivir. 2. Peramivir. 3. Zanamivir. Prevention. How can I reduce my risk for bird flu? The greatest risk is for people who work with poultry. If you have a job in the poultry industry, you should take precautions like wearing protective equipment at all times. If you don't work in the poultry industry, avoid poultry farms and markets if you're traveling. Be careful if you are in contact with wild ducks or other waterfowl. Always practice good hand washing techniques and avoid touching your eyes, nose and mouth with unclean hands. If you do visit an area that has reports of bird flu, be sure to contact your healthcare provider immediately if you have any flu symptoms. Poultry farmers and processors need to be aware of any type of bird flu in the area and to stop work immediately. There's a vaccine against bird flu in the US, but it's not yet available to the public. How do I take care of myself if I have bird flu? You can treat symptoms of bird flu the same way you would treat seasonal flu symptoms. This includes 1. Taking any antiviral medication as prescribed. 2. Taking acetaminophen or ibuprofen as directed for symptoms like pain and fever. 3. Drinking plenty of fluids. 4. Getting plenty of rest. 5. Washing your hands often and taking care not to pass on any germs. If you are new at our channel, please subscribe our channel. It will be great support for us.